Okay, so for femoral access, again, going back to some of the anatomical considerations. So navel is particularly high yield to remember when you're talking about the area surrounding the femoral nerve, artery, and vein. So again, let's just get our bearings here. So this is medial, and out here is lateral, okay? And you can see that if we're going from lateral to medial, we have our navel, which is the femoral nerve, the femoral artery, the femoral vein. We have an empty space, and then we have some lymphatics, which are not really depicted well in this image. The femoral nerve is the only structure here that is not enclosed in the femoral sheath. Okay, so that's kind of one of those one-off facts just to be familiar with. So the femoral nerve is not contained within the femoral sheath. And if you look closely, you can kind of see this is the femoral sheath here. Okay, and you can see that the artery, the vein, and the lymphatics will usually be in this femoral sheath. And this thing right here is kind of this area of empty space, okay? So this is actually the femoral canal. And what this is physiologically thought to be used for is if I have, a backflow of blood or engorgement in this vein, I have some room to accommodate venous dilation in this area. But what really ends up happening, particularly in females, is there's an area of weakness that can form above the inguinal ligament here, and you can actually herniate bowel potentially into this area, and that's where you would get a femoral hernia. And the other thing is, we can access the femoral artery or vein in this region. Okay, it's kind of like the preferred region to access. Okay, so what do I mean by that? So I talked about coronary angiography and PCI in the anatomy video, and the site, remember I said this is an arterial access, so if we're going to access the femoral artery, we would do it in this region. Again, this is below the inguinal ligament. If you try to access this artery above the inguinal ligament, the patients are going to be at significant risk of retroperitoneal hemorrhage, or a much higher risk. Okay, so you do not want to access above. You want to access below the inguinal ligament if you see that in a board question. And again, the way that they would tell you that this is where the femoral artery is you just have to follow the pulsation. So you're looking for femoral pulsation below the inguinal ligament. That's your target. And if you're going for venous access, things we talked about, like the Swan-Ganz catheter for measuring pulmonary capillary wedge pressure, or transseptal left atrial catheterization if we're doing an ablation for AFib, right? We talked about all of this in the anatomy video. But to detect where the venous access site is, we would go medial to the site of femoral pulsation. So I would feel the pulsation and I would go medial. That would get me to the femoral vein, again, below the inguinal ligament. If I went lateral to the femoral artery, I would damage the femoral nerve, and that can turn into a board question too.